Okay, hello, and thank you. Thank you all for taking time to join what I believe is our first ever lunchtime webinar. My name is Mandy DeLeo, and I'm the Water Quality Monitoring Coordinator for Patapsco Heritage Greenway. Our mission at PHG is to preserve, protect, interpret, and restore the environment, history, and culture of the Patapsco River Valley for all. To meet the goals of our mission, we do all kinds of support and programming related to the arts, culture, history, heritage, and environment of the region. On the environmental programming side, we started a water quality monitoring program in 2021 in partnership with the Alliance for the Chesapeake Bay. Since then, we've been monitoring physical and chemical parameters in the non-tidal Patapsco and tributaries. Over the years, we've expanded our volunteer pool, our number of sites, the number of parameters we monitor, and included a biological monitoring program where we collect macroinvertebrates twice a year at each of our sites. This year, we took on an undergraduate intern from the University of Maryland School of Public Health. Apoorva Ajith has joined us in January 2024 and undertook a side-by-side comparison of two bacteria collection and cultivation methodologies, our current method versus a proposed new method. Today, our amazing and multi-talented intern, Apoorva, will share with us the details of her work. We have formatted this as a webinar, which means that participants will have the opportunity to submit questions, but only through the Q&A feature at the bottom of your screen. We've reserved a few minutes for questions at the end. So if you have a question, please do put it in there and we will read it out loud to the group and try and answer it at the end. Also, please note we are recording this session and it will be available on PHG's YouTube channel in the very near future. And now, without any further ado, I present to you Apoorva Ajith and her talk, The Scoop on Measuring Poop, Comparing the ColiScan Easy Gel and R-Card ECC.
All right. Hi, everyone. Good afternoon. Thank you so much, Mandy, for the introduction, and let's get right into it. So for some background, as many of you know, E. coli is an indicator bacteria in streams and rivers that is measured to determine the levels of bacteria that can make people sick. So PHG measures E. coli bacteria as part of its water quality monitoring, as Mandy mentioned, to gain a better understanding of overall water quality in the Patapsco River and for use in their awareness and educational materials like our 2022 water quality report, which you can find on our website. Currently, we use the ColiScan Easy Gel to measure for E. coli bacteria. This is a technology that has been around for decades and has been used across the country. And basically, it involves using plates such as those pictured here on the screen, a media that is mixed with sample from the river, which is then incubated and then checked for colonies. So in 2020, PHG started having some issues with the with the ColiScan Easy Gel and measuring colonies. The main issue being in the consistency of the plate. So in the picture there on the left, you can see that the surface of the plate looks a little bit wrinkly and crackled, and the one on the right is smooth. So the one on the right is the ideal version, is what we want to see. And PHG did contact the manufacturer with their concerns, and we're told that it is okay to use those, but still the question of consistency was of a concern. The ColiScan also takes about 24 to 48 hours to be processed from collecting the sample to when you can read the results. And with sample bottles, media bottles, Petri plates, and pipettes, it does have a lot of disposable waste. So as an environmentally focused organization, PHG was looking into options that use less materials. And that new option that we are looking into is the R-Card ECC by Roth Bioscience. So the purpose of this study is to test the accuracy of the R-Card ECC compared to the currently accepted ColiScan Easy Gel. So we tested 4 different methods, which are shown on the screen. To the left, we have the ColiScan, which is our baseline, and the 4 other methods use different combinations of the R-Card technology and sample volumes on these cards. You'll notice that we have 2 types of R-Cards listed as the tools pictured here. So these are what the cards look like. At the top, you will notice one card, which is the R-Card ECC, and at the bottom, it is the R-Card, slightly bigger version, R-Card ECC 3 ml capacity. So for the R-Cards, just an overview of the procedure with them, very similar to the ColiScan with the sample that is collected from the water. It is pipetted onto the cards. If you can see that there's a film in the center of the cards where it kind of looks a little bit cream colored, a little bit off colored in the picture, that is a film with bacteria growing media on it. So when you lift the film, you pipette the sample onto the paper and lower the film. The card is left to set and incubate for 24 hours. And then similar to the ColiScan, the results look as they do on the right side. And then the blue and purple colonies are read as E. coli, and the pink colonies indicate other bacterial coliforms that we do not count. So this is just an example of what all these 4 methods look like. So for each water sample, all 4 cards and 1 ColiScan plate is tested for just 1 water sample. Early on in the process, we learned about the multiple types of R-Cards that vary by the sample volume. These pictures are from the Roth Bioscience website, and they are advertised as being basically the same, with the main difference being in the size. These are the pictures, again, available on the website, and the instructions and videos on their website only feature the R-Card ECC on the left. So when we received the cards in person, we were able to see a little bit better the difference between the 2. So first, the main difference you should be able to see is the layout of them. On the left with the original card, there is a dedicated space for writing the date and number or sample ID, and the film does not overlap with the entire card. On the right, it's a little bit harder to see with the colors, but the ECC 3 ml capacity, not only is it bigger, but the film does go right to the edge of the paper. And this can affect how the sample and the liquid spreads out on the paper, which we'll circle back to later. Another difference is the way the grid is printed on the card. So to the left, again, the R-Card ECC, the grid is printed on the paper. And in the example on the right, with the bigger card, the grid is printed on the film. So the grid helps not only when we're counting the colonies after processing the samples, but it also helps with placing and making sure the sample is centered on the card when placing it. So this was just another small difference that we noted that affects how you use the cards. One final difference, as I mentioned, about the film placement. On some of the cards on the R-Card ECC 3 ml capacity, the film did not completely line up with the paper. So on the right side, you can see, if you look at the bottom left of the card, you can see that the film kind of goes onto the table a little bit. It doesn't exactly align with the paper. When we are pipetting samples onto it, this can be an issue because cards like this are more prone to having the sample leak off of it. And when that happens, that just means we can't use that card and we have to try again. And sometimes it can be several tries before getting it right. And for PHG, an organization that uses the help of volunteers with our monitoring, making sure that we have tools that are easy to use is definitely a big concern and a priority. So this is a map showing some of the sample sites of the study. These are the 11 sites up and down the Patapsco and its tributaries that PHG monitors for its monthly water quality monitoring. I sampled mostly from a rotation of 7 regular sites, but also from additional sites pictured here during this monthly monitoring. 2 sites are also not included in this graphic, which are Herbert Run and Southwest Area Park in Baltimore County. So we've collected samples from our different sites over 15 weeks. We've recorded the bacteria counts for each sample, and we've analyzed the data. Let's get into the results. As I stated before, the goal of the project is to compare the R-Card methods to the ColiScan Easy Gel, which we are calling our baseline. So when we're analyzing the data, the first thing that we did is to find the difference between each R-Card method and the ColiScan. Then we compared the data sets of the differences to see how close they were. So this first figure shows the distribution of the differences of each of the R-Card methods, methods 1 through 4 from left to right. And if there were no difference between the bacteria counts for the R-Card method and the ColiScan method, which is ideally what we would want for there to be no difference, then the result would be 0. So what we are looking for is to see what has a spread that is concentrated around 0. So from left to right, method 1 has the highest spread. Methods 2 and 3 are pretty clustered, followed by method 4. So based on this figure, methods 2 and 3 in the middle have the most clustered spreads, and the X's in the middle show the mean of the sample. It's very important to note, and a great sign, that that there is no statistical significance between these 4 methods. We can tell based on the overlapping error bars of the graph. So if we were to put all 4 of those boxes on top of each other and compare the outlines of them, they would all overlap. And that means that there is no statistical significant difference across the 4 methods. And we confirmed this by using an analysis of variance test on the data across these 4 methods with the differences, and then also across the bacteria data of all of the methods with the R-Cards and the ColiScan, confirming that there is no statistically significant difference between the 4 methods, which is great. However, we are going to look a little bit closer because even within this, there are a few methods that shined a little bit more than the others. So the way PHG reports its bacteria data is not just by recording the data in numbers, but it's also by reporting it by category. So with reporting, we categorize it as above threshold, which is 235 colony-forming units per 100 milliliters. So a sample would either be above threshold or within threshold. PHG further divided this into high, medium, and low levels, which are defined in the table there. But just important to keep in mind that this high, medium, low is still within an acceptable range. So to talk about the categories, we looked at not just the numbers, but what those numbers would be reported as, like what category they would be reported as. And we looked at, are the R-Cards and the ColiScan reporting the same categories, not just the same numbers? So the chart on the top left is showing how much of the time they reported the same category. And it's great to see that, similar to the first figure, they are reporting the same categories most of the time. To look at this and break this down a little bit further, we looked at the chart at the bottom right to see, are the categories, when it's different, is it a difference between reporting something as above threshold or within threshold? So this definitely showed some of the more detailed differences between some of our methods. So the method that had the most categorization, the least difference, is method 4 at the very right on the bottom chart. And what this means is that when there were differences between reporting, most of the time that would be the difference between maybe reporting it as medium or low, both of which are still at acceptable levels. However, in contrast, method 3, about 10.7% of the time was reporting differences between having the R-Card would measure a sample as being above threshold, and the ColiScan would measure it as being within threshold. So this is a really important difference in how we actually use the data. One interesting thing that we noticed was that in reporting the categories and also in this chart, the R-cards tend to measure a greater number of colonies. This could be due to a number of things and influenced by a number of things. Something that we considered is that the R-cards appear to be a slightly smaller surface area and on a white background. And when we're looking at colonies on the ColiScan, the media pictured here has kind of a pale yellow color. And it can be pretty difficult, even with guidance from the manufacturers, to discern what size and color of colonies to count. So as I mentioned earlier, with both of these technologies, we count blue and purple colonies, and we do not count the pink colonies here. So with this example, we would count this actually as 1 because of the 1 dark colony at the bottom of the plate. However, if you look closely, you can see kind of smaller, more what we would call pinpoint colonies up towards the top. So it can get a little bit difficult to decide whether or not to count those. But based on guidance from the manufacturer and the instructions, we would count this plate as 1. Maybe on the R-cards, it might be easier in comparisons. Points that size might look a little bit bigger, or the color might look a little bit different. So these are just things to think about that may have inflated the E. coli colony counts on the R-card methods. Talking a little bit further about having high counts, the R-cards also present a benefit when measuring very high bacteria counts. So this is all from one sample at Deep Run in March after we experienced pretty high rain and runoff into the water. And on the left, as you can see, there was so much bacteria that the ColiScan plate turned a light blue entirely. And when this happens, we are unable to really put a number to how many colonies we are counting on the plate. However, on the right, with the R-cards, though it is pretty concentrated, and again, lots and lots of colonies on the card, with the help of the grid, we are able to count the number of colonies. So even though regardless, this would be a very, very high count and a very, very high number and reported as above the threshold, it's still a benefit that you would be able to count and be given an exact number with the R-cards. To talk through some limitations, the first limitation would be the time. Again, the study, the samples were taken from January through April. A longer study would be able to just encompass a greater sample size and also encompass a lot samples from different weather conditions, more so than just January through April. Kind of related to the time, because we were only able to take some trial and error to finalize our procedure with looking at the differences between the R-cards and kind of talking to other water quality monitoring groups and see what their input was. If we had, again, similarly more time, we would be able to finalize our procedure for the study a little bit earlier and collect more samples. The main limitation would be the quality assurance, and that we did not test the internal consistency of each of the methods. So for this, we were trusting the company quality assurance of the manufacturers. With the ColiScan, that, as I mentioned before, the technology has been around for years and years, and it is also an EPA-approved reporting method. And actually, for the R-Card ECCs, we were able to contact the manufacturer and receive a certificate of assurance for the batches of the products that we use. So that was also good for quality assurance. And the Alabama Water Watch is also currently conducting an EPA methods evaluation to see if the R-Cards can also be an EPA-approved method like the R-Card. It's like the ColiScan. So keeping all of this in mind, our data, our statistics, our anecdotal evidence, we are able to make two recommendations. The first is for method 2, which is using 2 milliliters of sample volume on the R-Card ECC. And this is because from the first figure, method 2 had a very concentrated spread around 0, which is great to see, and also was very similar in reporting categories. However, one thing about this recommendation and this method is that it is not using the R-Card exactly how the manufacturer recommends it. For the R-Card ECC, Roth Bioscience recommends limiting the sample volume on the card to 1 milliliter. We tried out 2 milliliters and we did not have any issues with leaking or getting results from it, which is why we continued using and testing this method. But it is important to note that this is using the card in a way that is not explicitly recommended by the manufacturer. On the other hand, our second recommendation is method 4, which is using 3 milliliters of sample volume on the R-Card ECC 3 ml capacity. So this is using the manufacturer's recommendation and instructions for using 3 milliliters on the 3 milliliter card. However, as I mentioned earlier, we did have issues with having the cards leak. So even over the 15 weeks of the study, there were problems with having the card leak. And again, when that happens, you have to just use another one. And even with practice over the 15 weeks, this still happened right up until the end. So it was really hard and frustrating at times to manage with this method. However, again, method 4 also had a similar spread and very similar reporting on categories compared to the ColiScan. Implications of the study, the R-Cards are for PHG and similar organizations are a great opportunity to reduce long-term costs while still upholding the same quality standards. So mainly it's easy, they're a lot more portable than the ColiScan Easy Gels, they are faster and they use less waste. And with this, aside from just being able to collect our bacteria data, it also has good implications on our engagement side of it. So with volunteers, because it's a little bit easier to use, it's very easy to train our volunteers on how to use it. Because it's portable, we're able to take even the R-Cards, some organizations take the R-Cards with them to the site and collect water directly from the site and let the R-Cards solidify there instead of bringing them back to an office or a lab. So that can be useful. And also that means that the R-Cards can be used in engagement events and they're just a little bit easier to show people and get other people really hands-on involved with water quality monitoring. Also, because they're faster, we are able to collect the data and process it within 24 hours as opposed to 48 hours. So this means that we can report the data faster. And in events, like especially after high rainfall or the example I showed you with the very high bacteria counts, this could be useful in letting the public know about any safety issues, or if we notice any issues on site, reporting anything to higher authorities that they can look into the issue more. Thank you so much for your time. And we have a few minutes for questions. I've also left our contact information and our website there.
Thank you, Apoorva. We do have a couple questions if you don't mind addressing them. I'm going to go ahead and read them out loud so that our participants can hear, because I don't know if you can see them. The first, I think if you could just sort of briefly address why the consistency of the Easy Gel ColiScan tests was a concern. Did it affect the sample? That was a question from Alexa.
Yeah, that is a great question. So yes, it was a concern. When conducting this study, again, that was a limitation about us not testing the ColiScan itself, but we definitely made sure to kind of use our best examples that we could. So in the slide where I showed you the difference with the kind of crackly looking ColiScan sheet and the smooth looking one, the smooth is the ideal. So when possible, we would use those ideal plates to kind of avoid using one that maybe is not the same quality. Also, the consistency is a concern in general as to why PHG wanted to test the R-Card in the first place. There are a couple times where even over this process, the ColiScan did not, it took a little bit longer than usual to gel. Like the media wouldn't solidify completely before putting it in the incubator, or even upon processing it, you would find after waiting 48 hours to process your sample that you look at the ColiScan and there are no colonies on it. And we use the plates that also measure for those pink colonies, as I mentioned earlier. And those pink colonies are basically always present in the water. So if you get no pink colonies, that's definitely a concern that something may have happened. So I hope that answers your question, Mandy, if you want to add anything about the ColiScan concerns.
No, I think you've covered it. Thank you. I would like to move on to our next question from Sophie. She says, Apoorva, amazing work. I'm curious if you tested any other methods with distributing the water sample on the card differently than the manufacturer suggests. For example, using a bunch of small drops to cover the card instead of dispensing the pipette all at once.
Yes, also a great question. We did try a few different methods of distributing the water sample on the card, especially when it kept leaking. So the first way that the manufacturer recommends is distributing the sample on the card all in the middle and then gently laying the card down. Again, when we did that, we had issues with it spreading out too fast or a little bit irregularly and leaking off the card. So after that happened, we kind of tried another method. And the second method was pipetting small water droplets all over the card. So maybe we figured this might let it spread out a little bit more slowly or a little bit more evenly. This tended to work a bit better for us than the first method, but we had leakage still. And for us, this also led to having a lot of air bubbles underneath the film surface. So when there were air bubbles, that meant that in that spot, the water sample was not coming into contact with the media on the film. And also just that it meant it spread out more, and we wanted as few air bubbles as possible. So that did work for us some of the time. But what we also tested, and this will be included in our draft procedure as well, is pipetting the water sample in almost a square shape in the middle of the card, and lowering the film quite slowly to avoid air bubbles. So I noticed that when I spread it in a square shape, that helped the sample, when the film was placed down, spread out to the corners. And we still had some issues with leakage, especially when the film and the paper were offset, as I showed in that one picture. But for me, this method worked the best and helped the sample spread out to the corners a little bit better than the other methods.
Thank you, Apoorva. Thanks for handling the questions. It's 12:29. So I just wanted to wrap up by saying that we are taking this information under consideration, and we're working with our PHG board and technical advisors and partners like Sophie at the Alliance for the Chesapeake Bay on how to proceed with this potential change in protocol. So we thank you for your work, Apoorva. And if anybody has questions that didn't get answered, I encourage you to email Apoorva or myself. Both of our emails are up there. I'm the coordinator at patapsco.org. And then also there's our website there, patapsco.org, for any information about events or programming at PHG. And finally, I would like to thank the Howard County Office of Community Sustainability for their partnership and support for our water quality monitoring program. Thank all the volunteer monitors who I see on you on the call today. Thank you for showing up here today and for helping us do the critical foundational work of our water quality monitoring program. Thank you to our PHG technical support for the day, Galen Mitchell, for always making us look good. And last but far from least, to the most amazing intern that I've ever had, thank you to Apoorva for all your hard work. I see Bonnie said she's not hearing the closing. I hope that I'm talking loud enough. I think Apoorva can hear me. But Apoorva, it's been great having you. Thank you so much for your hard work on this. And thank you again, everyone, for coming out today. We'll go ahead and close down the webinar, but if you'd like to see it again, it will be on our PHG channel, and you can share that information with all your friends who are interested in bacteria monitoring. Take care, and that's all for today. Take care. Bye-bye.